All right, we have a great guest on with us. You may have seen him on a ton of different shows. He's been on the Tonight Show. He's been on the Late Show. He's done local news, talked about a lot of different health experts. He is the lead physician and founder of Tower Diagnostic Health Medical Group in California. He's an expert on health and wellness. We're going to talk about some different disease prevention, dietary concerns and suggestions. We have Dr. Carey Strom with us. How are you doing, Dr. Strom?
Good, Brandon. How are you? Thanks for having me.
Oh, I appreciate you fitting us in. I'm going to jump right to probably the one thing that's closest to my heart. I suffer with a whole litany of food allergies, and I know there's probably a lot of myths. There's a lot of, I don't know, good advice, bad advice. Where are you at on some of these things, and what are some of the tips that you kind of think that most of your patients need?
Right. Well, I mean, to really diagnose food allergies, they go to an allergist and they have scratch tests where they place a little bit of the food in a little injection on the back and see if there's a reaction. So there's a lot of myth about food allergies. Some people say they get upset stomachs, they get rash, whatever, and a lot of them are really not true allergies. So to diagnose an allergy, you need to go to an allergist and have skin testing with different foods to see if you're truly allergic.
Couldn't agree more, and it was definitely an eye-opening experience for me. We discovered all sorts of things that we were not aware of, and then they kind of go through a regimen with you where they have you fast off that food for a period of time, and then you kind of binge on it, and you really start to see what kind of symptoms actually manifest from that particular food. And the other reason I'm a fan of Dr. Strom's work here, he's definitely one that is definitely a lot more of a moderate doctor when it comes to the exercise and dietary thing. Advocates a lot more mindful eating and exercise, and quote, about a half hour a day, nothing terrible. He's not trying to run me in marathons and trying to put me on a rabbit diet. He's trying to keep a lot more moderation. And, Dr. Strom, is that kind of the 2015 thing that's going to work for people? Try to find something that's a little more moderate instead of some of these extreme, fads, if that's the lack of a better word?
Yes. I mean, there is even articles out recently that excessive exercising can hurt you. So I'm a firm believer in daily exercise. You don't want to tear down your body. I'm getting a little older myself, and I just don't want to have a lot of wear and tear. But I believe about 30 minutes a day to get your heart rate up. A lot of it is body, but a lot of it is also mind. I will tell you personally, when I don't exercise, I start to feel it in my head, not so much in my body. But I think it achieves two goals. It's the fitness of the body, the shape and the tone, and it also keeps the mind sharp. As a matter of fact, there are studies that showing exercise can delay the onset of Alzheimer's. So I think, and it also makes people feel good. I mean, I don't know if you exercise or not, but when you exercise, how do you feel when you get done? The hardest part is putting on your shoes to go do it.
Absolutely, and I think that is definitely the best thing, is to just find a way to get active for a period of time every day and, jack up that metabolism. When we're younger, a lot of that stuff comes naturally. We don't have to do a whole lot to kind of supercharge our bodies, but as we get a little older and some of the slowdowns take effect, and you kind of have to do a lot of that more consciously, make conscious decisions to do that. And I couldn't agree more. I always feel better after I've been moving a little bit, and I'm not much of a runner anymore thanks to my knees, but boy, I tell you what, if I'll walk a couple miles, I actually feel pretty good. And I got to be honest, took a little bit to sell me on that.
Well, even physiologically, it makes very good sense. You stretch out your muscles, you keep the bones strong, you pump the endorphins, you increase release of cytokines, and you keep in shape. I mean, it's good for the body and the mind, but also, like I said, it does delay the onset of mental decrease in acuity as people get older. I think older people should exercise every day. It doesn't have to be very traumatic. You don't have to go run. You can go swim. I mean, it's easier on the muscles, but any type of exercise that gets your heart rate up every day is a good thing. Now, having said that, you have to make sure there's no underlying heart disease or any other type of condition that would prohibit you from doing it. And obviously, you should check with your physician before you embark on an exercise program.
We're talking with medical expert Dr. Carey Strom, and you can go to drstrom.com, find out a lot more information about his work, some of the advice things that he's already done appearances on TV. There's a lot of information out there that he's already done. He's really kind of at the top tier of being able to get to the actual truth and fact and through some of these big myths. And let me turn to colon cancer, and obviously it's such a lethal disease, and I'm right in that age group right now where I'm transitioning into, going to have to go on to the regular cycle of when I have a colonoscopy done. what are the real facts of when we should do that? What are, who's at more risk than others? DNA testing. Where do you come down on what really needs to happen here?
Okay. Well, the guidelines are, in the general population, somebody that doesn't have a family history of colon cancer or colon polyps is to get screened at the age of 50 and probably do it every 7 to 10 years. Now, if there are symptoms of change in bowel habits, rectal bleeding, or a very young onset of a relative that had colon cancer, you're going to get screened at a younger age. Colonoscopy does prevent colon cancer. One's lifetime risk of colon cancer is probably 6 to 7%, and it increases 10% per decade. So what we usually say is a 50-year-old person, male and female, have the same incidence. Their risk of having a colon polyp is anywhere from 25 to 30%. So we do the colonoscopy to take the polyp out because we just don't know which polyp, if any, is going to turn into the malignant one. So we go ahead and have it removed. Now, the colonoscopy is very, very safe. I've had them myself. I've done about 27,000 of them.
Wow.
The risk of any untoward side effect, perforation, is about 1 in 1,200. But if you go to somebody who is experienced and has done a lot, like any procedure, you want to go to the one who's done a lot, the risk is very, very small. And for someone to not go through a colonoscopy because of the fear of a preparation or a complication is ridiculous. It's like getting a mammogram, a pap smear, a prostate examination. There are a few cancers that we can screen for, Brandon, and this is one, and it's a very, very good test. Now, you may have heard about the stool DNA testing. That is good, but it doesn't pick up all cancers, and I would not do that in lieu of a colonoscopy. You've heard of virtual colonoscopy. Virtual colonoscopy is a CAT scan of the colon. And believe it or not, it's very painful because the radiologist puts a lot of air into your colon. And like I told you, if you're a 50-year-old, your chance of having a colon polyp is anywhere from 25 to 30%. So if you diagnose the polyp on a virtual colonoscopy, you have to go ahead and do an actual colonoscopy to remove it. So the beauty of the colonoscopy is you can do a procedure for diagnosis and therapy at the same time, whereas a virtual you cannot.
That is probably that is a fact that does not get stated well, folks. You want to let's have him repeat that there to understand that you do a virtual and they find something, you still got to have the regular procedure done. So you're going through some discomfort, even if it's minor, twice instead of doing once.
Right, and look at you're going to take the same preparation for the virtual colonoscopy and the actual colonoscopy. The virtual colonoscopy does hurt. There's a miss rate of about 10 to 20% for polyps that are a centimeter or less. Look at the smaller polyps are less likely to be the bad ones, but still there's a miss rate. So it makes no sense to go ahead and have a virtual colonoscopy as opposed to a regular colonoscopy simply because you can take care of the problem at the same time of the diagnosis.
Absolutely. Couldn't agree more. And that's, wow, what great advice. Thank you again, Dr. Strom, for that clarification, because I think that is just so crucial. We'll make sure that's a large part of our information, and we're going to link back to his website, folks, in case you have further questions there, drstrom.com, and you can probably get some guidance and helpful hints to know how to, kind of ask the right kind of questions of your personal doctor, make sure that you get this effective screening done as a preventative measure. Prevention is the best method of taking care of yourself. And we always talk about eating habits, talk about an active lifestyle and that kind of thing. I wanted to see where you came down, because you really did have some great advice here too as well about recommending different types of multivitamins, fruits and vegetables, different things. What are some of the things that are at the top of your list that you want to tell me? You always want to advise your patients to make sure they're doing.
Well, it's very important, particularly when you get older, to be mindful of what you eat. And the main thing, what I always tell my patients and when I give lectures, is that mindful eating, portion control seems to really be a problem in this country. I mean, you know that 1/3 of children are, by definition, obese. So portion control is very, very important. Be mindful of what you eat. A lot of times when we eat, we get distracted. We're talking, we're engaged in conversation. We don't think we're feeling a little full, but that dessert looks really good, or that one looks good, and we taste this. We have to be mindful. I tell people to use smaller plates. When they use a smaller plate, they can't put as much food on there. Having said that, about mindful eating, it's very important to eat very high fiber, a lot of fruits and vegetables, really low on the carbohydrates, not so much, pastas and breads. You can do that, but desserts, sweets, because those carbohydrates are probably metabolized into fat and stored in the body. So high fiber, lots of fruits and vegetables. Grains are very, very good. I'm not a vegetarian. I do believe you can eat meat. I say maybe once or twice a meat. That's what I normally do. Fish is absolutely terrific. It's got a lot of vitamin A. It's very good it's got fatty acids, the essential fatty acids that we need. Chicken is also good. Red meat once a week. I'm not saying that you have to stop red meat. I would say just be conscious of the fact that you're not overindulging in red meat. People are talking about gluten-free. That seems to be very, very common now. People are sensitive to gluten, but that does not mean they have celiac, which is the actual disease from gluten. That's from gliadin. That's allergic to a protein in gluten. And people that truly have celiac, they have to be mindful they cannot eat gluten ever again in their life. But some people are not celiac that are sensitive to gluten, and it seems to be the fad now. I would say discuss that with your doctor. A lot of people come into the office with abdominal symptoms, and we diagnose as an irritable bowel. And people will say, once I got off of that in my diet, I felt better. Once I got off of gluten, I felt better. And that's perfectly fine. But make sure you're truly sensitive to something before you change your whole life on that. So mindful eating is very important. If people want to stay in shape, eating is more important than exercise. You can't go ahead and indulge yourself and then really work out hard, because it's going to take a lot more to burn off those calories. So start at the starting point, eat mindful, eat right, and then you can work out at a much lower pace and still maintain your healthy lifestyle and your body shape.
As we close out our talk with Dr. Carey Strom about some different eating practices and health practices, he definitely was one of the experts that spoke out when we got the news. I know he was on CBS News about it. We're talking about probiotics, and Dannon, of course, was finally called to the carpet of some of their claims and some of their misrepresentation of what their yogurt is able to actually do for you. And, how did you come to find out that, and what was your take on how that's being handled?
Well, the probiotic story, it's not the panacea to excellent health. I like probiotics. I recommend probiotics to my patients, but it is not the silver bullet. Probiotics are good when people go out of town, they go to a foreign country, the flora of the gut changes. When people take antibiotics, because antibiotics can kill off the good bacteria. I do like probiotics, but it may not be cracked up to be what everybody is reporting and marketing. Now, probiotics, for the most part, are pretty safe. Very few side effects. But as I say jokingly to some of my patients, the main side effect of probiotics is poverty, because it's very, very expensive. But I do prescribe them. I do like the live probiotic, the live bacteria. I don't like the ones that are killed because they're not as effective. The ones that stay refrigerated tend to work a little bit better. So I do believe them, and I do prescribe them, but I don't think they're cracked up to be what they're purported to be in a lot of these marketing and advertising campaigns.
Dr. Carey Strom, folks, you can go to drstrom.com, get a lot more information and guidance, check out some of the interviews. We'll link to some more of that information as well, some of the articles that he's contributed to and passed along. Just great tips, great information for folks, especially in an age where you can almost find anything on the internet that you can agree with. It doesn't mean that it's right, and it's great to finally get a chance to talk to an expert on some of these topics. Dr. Strom, thank you so much for fitting this into your schedule.
Brandon, I just want to mention the website is Dr. Strom, but doctor is spelled out, DoctorStrom.com.
Perfect. And we'll definitely link to that. Make sure it's easy for everybody that's catching this on the internet.
Well, thank you for the opportunity, and it was really nice talking with you, and thank you very much.